You're listening to Healthy Communities. Your hosts today, Dr. Maya Thompson and Danielle Brooks, are virtual voices designed to reflect the diverse experiences and expertise of Jefferson's healthcare administration community. Today, we're jumping into a field that's, well, always changing: healthcare administration. New challenges, new opportunities popping up all the time. So the big question, Danielle, especially if you're maybe just out of college or in the early stages of your career, is how do you get ready to actually lead in that kind of fast-paced world?
And that's where we're focusing today, Maya. We're taking a really close look at one specific route, the Master of Healthcare Administration, the MHA program, over at Jefferson College of Population Health. Okay. Our goal here is to sort of unpack what this program is all about, specifically how it gives you the skills, the mindset to really thrive. We're using info straight from their website, plus some great insights from the program director, Dr. Mary Cooper.
Right. Let's talk about that, because the need for formal training seems, well, more obvious than ever. Yeah. And her perspective is fascinating.
It really is. Mary Cooper spent 35 years in healthcare administration, like at the top, and she says she wishes she'd done an MHA. That's pretty powerful.
It's huge, yeah. She talks very openly about having to learn so much practical stuff, on the fly during her career.
Well, she mentions things like getting good at spreadsheets, financial forecasting, really understanding ROI, return on investment, figuring out complex supply chains, adopting new tech quickly, things that took her years, basically.
Things you probably don't just pick up easily.
Exactly. And the program, that's the contrast. It gives you a real structured academic grounding in those specific areas from the start. It's designed to give you a real leg up, skills that, like you said, even experienced leaders sometimes had to figure out the hard way.
So it's more than just the practical skills, isn't it? There's a deeper philosophy here. Sounds like it's aimed at something bigger than just day-to-day management.
Absolutely. The core idea that comes through is preparing you for transformational change.
Transformational change.
Right? Yeah, it's not just about keeping things running smoothly. It's about teaching you how to, as they put it, pivot rapidly when things get unpredictable.
Like a pandemic, maybe, or policy changes.
Precisely. Natural disasters, new government regulations, public health crises like COVID. The idea is to develop leaders who can actually strategize and lead through that kind of flux, not just react to it.
And thinking about that adaptability, it probably opens up more career paths than people might first assume. You hear MHA, maybe you just think hospital administrator.
That's a common thought, but yeah, it's much broader. The program really prepares you for leadership across the whole spectrum of healthcare organizations.
So beyond hospitals.
Oh, yeah. Pharma companies, medical device companies, different kinds of patient care settings, outpatient clinics, long-term care, you name it. Anywhere healthcare happens and needs strong leadership.
Okay, that makes sense. So if it's aiming that high, how does that actually work? Especially being online. You mentioned it's 100% online, accelerated terms. That sounds flexible, which is great if you're working or have other stuff going on.
Right. The flexibility is key. They use an asynchronous learning model.
Asynchronous, meaning?
Meaning you don't have to log in at specific times for like live lectures every week. Yeah. There are definite deadlines, milestones you hit each week, but you do the work on your own schedule.
Okay.
It's really built for people with unpredictable hours or family commitments. Yeah. The rhythm is generally you get materials over the weekend, readings, maybe audio stuff. Then there's a discussion question posted online. You respond by Wednesday night and interact with others. You reply to a couple of classmates' posts by Saturday noon. And then your main assignment for the week is usually due Sunday night. It keeps you engaged, but on your time. And the assignments vary. Journals, papers, quizzes, and interactive exercises.
Interesting. And I saw something that really jumped out. No capstone project, no big thesis at the end?
That's right. It's a deliberate choice. Instead of that traditional big research project, the focus is intensely practical, applying what you learn almost immediately.
So less theory, more doing.
Kind of, yeah. They want to cultivate leaders who can implement solutions, drive change right away. It's a different emphasis, and that practical side comes through in things like the QUIPS model, too. So these are monthly live virtual sessions. They call them cohorts.
Ah, so there is some live interaction.
Yes, but it's focused. Usually 3 to 4 hours on a Wednesday morning, second Wednesday of the month, 8 a.m. to 12 p.m. Eastern. And here's the interesting part. They're often led by external experts, people actually working out in the field, not just Jefferson faculty.
Oh, that's cool. So you get different perspectives.
Exactly. And they're interactive, small group work projects, you're networking, you're engaging directly with current challenges. Plus, they record them, so if you absolutely have to miss one, you can catch up.
What kind of topics did they cover in those early on?
Things like corporate communications, conflict management, foundations of accounting and finance. Really practical leadership skills.
Gotcha. And then there's the practicum experience as well?
Right. That happens in 3 of the 5 terms. It's another big piece of that practical application.
How does that work? Do you have to find your own placement?
You can actually work on projects within your current job. If you're already in healthcare, that's a huge plus. Or if you need a placement or want different experience, they partner with organizations, including, the big Jefferson health system, so you get real-world project experience.
Okay. And one other really specific thing mentioned is the Lean Six Sigma Green Belt. You get that in the first term.
Yeah, first term. Lean Six Sigma, for anyone maybe not familiar, it's a methodology. It comes originally from manufacturing. It's all about identifying and reducing waste, making processes more efficient, cutting out errors. It's a really valuable skill set in healthcare operations. And you get certified, a Greenbelt certification. It's done through a simulation. It's self-paced within the term, and it's what they call a terminal certification. You earn it, you have it, no need to recertify later.
That sounds pretty intensive for the first term.
It is, but they boast a 100% graduation rate from that part so far.
Wow, okay, that's significant. So putting it all together, how long does this whole MHA journey take?
It's 5 continuous terms, which works out to about 20 months total. Yeah. So if you start in the fall, you'd typically be looking at graduating in May of your second year. It's pretty focused.
Fast-paced, definitely. What about support? Grad school, even online, can be demanding.
They seem to have a really robust system. You get 2 key people, a faculty advisor focused on your academics, making sure you're succeeding in your courses.
Standard stuff.
Right. But you also get an executive coach.
An executive coach? What do they do?
Their focus is purely on your career success, helping with your resume, practicing interview skills, mapping out your career path. They even use personality assessments to help you understand your strengths and where you might fit best. That level of personalized career coaching is pretty unique and a big plus.
Mm-hmm. That does sound like a big advantage. And the faculty themselves...
Very diverse group. They bring in people with real-world experience from all over the country, not just Philly. So you're learning from people who are actively involved in the field.
Okay, and for tailoring the degree, are there specializations?
Yes, 7 concentration options. This lets you really deep dive, as they say, into an area you're passionate about, and you get to interact with other students from across the College of Population Health who might be in different programs but share that interest.
What are some examples?
Let's see, operational excellence, that's about efficiency again. Health quality and safety, really crucial. Population health, focusing on outcomes for specific groups like patients with diabetes or Medicare recipients.
Okay.
There's global health, health equity, tackling disparities. Post-acute care like rehab, home health, nursing facilities, and compliance and regulation policy, advocacy, health law. So pretty wide range.
It seems really targeted. Who exactly are they picturing as the ideal student for this?
They're pretty clear on that. It's great for recent grads, maybe someone who was pre-med or pre-health and decided clinical practice wasn't the path, but they still want to be in healthcare.
Makes sense.
Also, early career folks already working in healthcare admin who want to move up faster, and importantly, clinicians. Nurses, doctors, pharmacists, therapists who see themselves moving into leadership or management roles.
And they mentioned a partnership with a business school?
Yeah, the Canbar College of Design, Engineering, and Commerce School of Business at Jefferson. It suggests they're really trying to blend that specific healthcare knowledge with solid business principles.
Which brings up a common question. How is this different from just getting an MBA with a healthcare focus?
Good question. The core difference is the depth of focus. An MBA is fundamentally a broad business degree. Even with a healthcare specialty, you're covering general marketing, general finance, etc. An MHA, like this one, it's a business degree, but it's all healthcare all the time. It dives deep into the specific regulations, the ethics, the unique operational challenges of this industry. It's just much more specialized for healthcare leadership.
Okay, that distinction is helpful. So, boiling it all down, Danielle, what are the key things you think our listeners should walk away with today? What can you do after finishing this program?
Well, the outcomes are pretty direct skills. You'll be able to, really understand and explain healthcare finance, organization, and delivery.
The nuts and bolts.
Exactly. You'll gain management and leadership skills, specifically for leading diverse teams, managing change. You'll know how to use data, critically important to assess effectiveness, make decisions about resources, creating effective reports, presentations, even for high-level audiences like boards or senior execs, using critical thinking for performance improvement, developing systematic approaches to solve problems across an organization, plus foundational knowledge of quality and safety management, understanding healthcare law and regulations, and really solving those complex problems with professionalism, ethics, transparency. You're meant to be ready.
Sounds comprehensive. You're truly ready to hit the ground running, as they say, and hopefully find a job you really enjoy, like Dr. Cooper emphasized about her own career.
Exactly, finding that fulfilling, impactful role.
Okay, so if someone's listening and thinking this sounds like it could be for me, what are the practical next steps? Admissions.
Sure. Basic requirement is a bachelor's degree, which needs to be officially conferred before you start. They prefer a 3.0 GPA, but they stress it's a holistic review.
Meaning experience counts?
Definitely. Relevant work experience is seriously considered, so don't rule yourself out just based on GPA.
Great. So, summing up, for you recent grads, you early career professionals, this MHA at Jefferson sounds like a really focused, practical, well-supported way to accelerate into healthcare leadership.
It really is. It equips you to be part of that transformational change we talked about.
Makes you ready to make a difference.
Absolutely. So maybe the final thought for you to ponder is this. In this healthcare landscape that's changing so fast, what kind of transformational change do you want to lead? And how could a program like this MHA be the sort of strategic blueprint to help you make that impact?
And with that, it's time to wrap up this episode of Healthy Communities. Thank you, Danielle, and thank you, our listeners, for joining us as we explored how Jefferson's MHA program is helping to shape the next generation of healthcare leaders. If today's conversation sparked new ideas, questions, or even just a sense that this path might be for you, don't let that moment pass. Follow up, reach out, take the next step.